Welcome back to Patient Win Insider. I'm Nick Moen, and today I'm joined by Dr. Eric Block, founder of the Stress-Free Dentist and Acton Dental in Massachusetts. Dr. Block has built a nationally recognized approach to anxiety-free dentistry, patient psychology, and thoughtful practice designed to serve patients and prevent doctors from burnout. So today we're talking about patient trust, anxiety reduction, practice differentiation, and what it takes to grow a practice around patients in need. So let's get into it. Thanks for coming on the podcast, Dr. Block.
Yeah, you got it. Thanks for having me.
So give me a little background. Tell me, how did you get into dentistry, and what keeps you excited to get up in the morning to go in and practice?
Yeah, so I'm from Massachusetts. I grew up in Massachusetts, and I ended up going to Tulane University for college, which is in New Orleans. And I went there thinking I was going to be applying to the business school of Tulane. And I sat through some classes, microeconomics, statistics, and I was just like, nope, this is not for me. And I ended up switching to psychology as a major. And because I really didn't know what to do. And one night I actually just missed my mouth with a beer bottle, and I broke my number 9 central incisor right there,
Yeah.
and I cracked my tooth in half, and I walked around that night with half a tooth. And I went to, based off the referral of a classmate, I went to a local dentist in Metairie, Louisiana, and I just loved the way they took care of me, and they gave me my smile back. And I thought, you know what, maybe dentistry is something I could do. So I actually had to take a year off and do some catch up with the prereq classes and the DAT exams. And I graduated with a degree in psychology, but I took a year off and taught tennis and took physics and organic chemistry and all those classes. And I applied and got into Nova Southeastern, which is a dental school in Fort Lauderdale. And I went to dental school there. And then after, I did a 2-year implant residency, which brought me back to Massachusetts. And I entered into the real world as an associate. And I actually went through an extreme amount of stress and burnout I would say just under about halfway through my career. I had gotten to the point where I was so unhappy and just miserable being a dentist. I actually regretted my decision to become a dentist and thought about leaving, but I was in $250,000 worth of debt, and I didn't have any other skills. I figured, you got to do something here, because I was just so miserable. I was depressed. I was stressed. I was burnt out. I couldn't wait until the weekend to get home. I couldn't wait until 5 o'clock to get home from the day. And I couldn't wait until the weekend to decompress from the week. And I for sure said to myself, I can't wait until I retire so I don't have to do this anymore. And I finally said to myself, you got to do something here, Blocky, because you've got a long life to live, and you can't be going into work miserable. And I finally picked up the phone, and I called a local therapist, and I just started going to see a therapist and just digging into, why I was so anxious and stressed and burned out. Originally I thought there was something wrong with me. I thought maybe I just chose the wrong profession. I would have done anything else. I would have worked in a cubicle. And I thought about going to law school,
Yeah.
because I was so worried about getting sued that I wanted to flip the script and be the one doing the suing. But I knew that I'd always wanted to do therapy as a psychology major, but I finally just picked up the phone and did it. And it was one of the best things I ever did. And we just dug into, why I was so anxious. And it was mostly up here. It was just me putting too much pressure on myself, being a good old fashioned perfectionist and beating myself up when something didn't go right. And then also, I'm more introverted by nature, and the social aspect of the profession was just eating me up. It was exhausting, going from, doing a stressful procedure on my patient, and then popping up and going and do 5 hygiene checks, and, giving those patients my A game and always having to be on. And it was a lot like acting, and, doing that 8 hours a day for 10 years was just exhausting to me. So I got through it, and I'm actually I'm at the point where I love going into work every day, most days. But for me, I felt like I had a story to share, and that's where I wrote my first book, The Stress-Free Dentist, and started my brand and website and Facebook and the podcast. And I just felt like if I could help some other dentists out there go through, they're going through something similar that I was going through, then hopefully I could help them.
Yeah. So what were some of the symptoms? Like, are there like warning signs you can look for before the burnout sets in?
Yeah, for me, I always knew that at some point I wanted to go to a therapist, but a lot of people don't know and don't know where to turn to. But personally, I was finding that, first of all, I hated going into work. If I was on, if it was the weekend, I had those major Sunday night blues. If I was on vacation, I was dreading having to go back to work. I was disengaging from, conversations with staff, with patients. I was not wanting to do procedures. I was watching and monitoring versus treatment planning and scheduling procedures. And I just couldn't wait to get out of there. And it turned out that, I was having anxiety, and I always thought I was like the laid back fun dude. And for me to have my therapist tell me that I'm having anxiety was kind of a wake up call. But I knew something wasn't right, and I knew I was just unhappy. Luckily, I didn't turn to drugs or alcohol, or worst case, some we've heard the statistics of suicide. But my message to anyone out there is, if you're feeling like something's not right, you hate going into work, you regret your profession, you're feeling depressed or anxious, or just the stress isn't going away, then reach out for help. That's really the first thing you got to do is take action and reach out for help.
So what kind of strategies have you found to work? Like what strategies worked right away when you were already down in the hole of burnout? Like what strategies quickly pulled you out, and then what sort of daily practices or strategies are you currently using to stay on track?
Yeah, it for sure, didn't happen overnight for me. I met with this therapist for a couple years, and we dug in every 2 weeks, and we added in some prescribed medications. And it was actually probably about, at least I knew that I had a diagnosis. I knew there was something wrong, and I was on the path to trying to fix the problem. To me, that was a major eureka milestone. But after about a year, 6 months to a year, the negative thoughts that kept creeping into my head, and I know dentists, and I was one of them, I would not be able to shake the day. At night, I would be thinking about the one bad thing that happened, that one uncomfortable conversation I had with a patient or a staff member, that one filling that broke, and I couldn't shake it. And just started to focus on, first of all, taking care of myself. As dentists and healthcare professionals, we're so used to taking care of others that we often forget to take care of ourselves. And I started focusing on me. There became this like absence all of a sudden. Well, I shouldn't say all of a sudden, it was gradual, but there was one day where I'm like, you know what? I'm not focusing on the negatives anymore. I'm focusing on the good stuff. And I'm not up at night thinking about, the one bad thing that happened. And I also stopped with hanging out with any negative people. That was another major thing. I hang out with positive people, like-minded peers, engaging with colleagues. But it didn't happen overnight. It was a lot of work. It was hard work. But I'm always going to be part of some sort of therapy and working on my mental health, because we go to the gym and we work on our biceps, and we work on our muscles, and our brain is a muscle too. It's like a muscle, and therapy is like yoga for your brain. So for me, just starting that action and getting the help was really the biggest thing.
And how did that affect patient care? I mean, they come in anxious too, right? Patients coming in saying, well, I'm going to spend a lot of money on a procedure that can be incredibly invasive and uncomfortable. So they're coming in with anxiety. I mean, was that being reflected or projected onto some of the patients before you started, getting back on track?
Yeah, it when you first get out of school, you first of all you don't know how to talk to patients. I struggled with this big time early on in communicating with patients, communicating with staff, being a leader. I really was not trained for that, and I'm not naturally gifted at that. So for me, that was very difficult. And I was a hot mess, coming out of school. I was nervous with procedures, and I was, had major imposter syndrome, and I was showing anxiety and being nervous. And guess who's seeing that is my patients. They're going to reflect that, and they're going to be nervous and anxious. So as I started to work on myself and get more comfortable in my own skin and work on myself and get less anxious and stressed myself, that just started to work in, and my patients became less stressed and anxious. I also open myself up more with patients. And for sure, I don't talk about certain subjects like money, sex, religion, politics. I try to avoid those subjects, but I have opened myself up more with patients about my life. And that's been a ability to reduce stress with patients, because when I first got out, I had the white coat on and I kept this big barrier up and I pretended like I'm the dentist and everything's perfect and everything's great. And there's this big barrier between me and the patient. And I found that that was exhausting and it wasn't great for patient comfort.
Yeah. And, I think thinking about it, the dental patients are some of the people that spend the most time with, a specific member in a career. Like you look at maybe hairdressers, hairstylists, you get your haircut done, but that other than that, like doctors or other professionals, you get an hour tops a year with them or something. Whereas dentists, if you're going in for cleanings and x-rays and checkups throughout the year, I mean, you're spending a lot of time. You're building serious relationships with these patients. And so how do you approach nurturing those relationships, and what does it look like when you first meet a new patient? Like how do you kind of start how do you start engaging with them?
Yeah, and this is totally different now that I'm fully out of network, but we did that 2 years ago because now I have more time. I have more time to develop these relationships. And especially with that new patient, it is crucial. My flow is we have, 90 minutes. I'm seeing some of the new patients for their first visit, cleanings and exams. That is the best way. And I used to not have time for that. Now I do. But if the patient sees the hygienist first, then I make sure that the hygienist has done all the data gathering. We do diagnostic scans. We have AI X-ray diagnosis. We have videos, we have models to show patients. So we do an awesome exam. And then I come in and I first just try to connect with that patient. I don't talk anything dentistry at first. I talk, where you're from, what's going on in your life, that type of thing. I make a personal connection. And then I move the conversation to their mouth and how do your teeth feel, or what brings you in today, that type of thing. And then I bring the hygienist in, were there any findings? So there's a co-diagnosis there. And then we just, get in and do our exam. We do diagnostic wellness scans. So I show the patient their mouth in 3D. I show them the AI x-rays and they're super impressed. And I kind of leave it in their hands and I say, what do you think about your teeth when I show them the scans, or what would you like to improve about your oral health, your mouth? What are your goals? I kind of throw it back on them. And if we're running late in the hygiene room, I'll move them to my room where I have more time, or I'll have them come back in for a separate consult. But making that personal connection with the patient is a game changer.
Yeah, well, and you're you're asking them what they want. You're rather than, I think that maybe typically doctors will say, "Here's what you need," based on the data or the scans, and here's what you need, and then all of a sudden the price is attached to it. But when you sit back and actually engage with them and ask them what they want, what their goals are with their oral health, I mean, I think that's a game changer. I'm curious, like from a holistic perspective, how do some of the needs or wants that they have, how does that reflect from like a holistic health perspective, and how do you incorporate that into treatments?
Yeah, well, we first focus on the oral health. I always check for oral cancer, and I make sure I tell the patient, about that. We talk about airway a lot. I've the last few years got into sleep apnea and airway treatment, which is extremely, important these days, where we're finding out more and more about the ill effects of undiagnosed sleep apnea. So I get into, how, they're here in my chair. I'm trying to help them, not just, chew better and smile better, but live better. And, I used to not be able to have that time. Now with being fully out of network, patients are coming in and they're so much more valuable. The lifetime value of a patient is just that much more valuable than when I was in network with insurance. But I'd say the biggest issue is I'm just not running around with my head cut off, running around like crazy before. with packing the schedule because I was in network with PPOs. Now I can spend more time with the patient and talk about, their teeth, their gums, sleep apnea, clear aligners, TMJ, like all those things. They all just come up in the conversation.
And so you're less busy. Is that affected the bottom line as far as production goes?
So we actually grew by reduction. Actually, we're able to actually get rid of an entire hygiene column, which at the time was full of temporary hygienists, which is extremely expensive. And when we went fully, completely out of network 2 years ago, we lost about 15, maybe 20% of our patients, which is significant. But if you think about it, those patients were getting a 45%, at least 45% discount. So by trimming those patients and that hygiene column, I feel like we actually were improving. And the time that we have now, and mentally it's just so much better, just not being stuck with the insurance company's rules, their fee schedule, the conversations. Still patients are, some of them are very insurance driven. And they can absolutely use their insurance, but they pay us up front, then they get reimbursed. The conversations are not focused around insurance like they used to be. It's focused on the care that they need, the quality of care they're going to get, that personal connection that we've made. They can still use their benefits, but it's all about getting them educated and understanding the value, and getting them to move forward with treatment.
Yeah. So you're growing and have more time on your hands. And part of what you're doing with this extra time is you're educating other dentists. You're giving back to the industry. What was kind of the first step that you took in order to, I guess, remove yourself from isolation and start re-engaging with your community?
Yeah, it was COVID. COVID gave me, the gift of time to a light switch went on, and I just, this entrepreneurial light switch went on, and I, tried to figure out what my mission in vision in life and in dentistry were and what they were going to be. And before COVID, I was just a dentist. That's all I did was just dentistry, and my whole identity was being a dentist. Now I have a lot of other things going on. I have the podcast. I have a software I'm working on. I have a life coaching organization. I write books. I do speeches. I help other dental professionals. And it's really actually helped my main gig, which is being a dentist. I go into the office, excited. I wake up every day looking forward to what the day brings. The day just flies by because I'm so busy and doing stuff that I love doing. But it really started with during COVID.
Yeah, yeah. And as far as where things are headed, now that you're, in a stable position, you're growing the business, are you still taking on new patients then as well?
Yeah, and actually, I'm more re-energized than ever by going out of network. It's one of the best things that I've ever done. It's so freeing. You practice dentistry the way that you want to, and not the way insurance wants you to. So that, to me, to any dentist listening out there, you have to do it strategically. You have to do it. You can't just do it willy nilly. But don't give into that fear that you can't do it. If you've built good relationships with patients, they'll stay. Some may leave, and that's okay. But a lot of them come back. So we yes, for sure, we see new patients. We're having a lot of patients come back to our office that did leave. So our numbers are getting pretty close to our volume of where we were back before we went out of network. But I keep myself re-energized by just, I call them the 3 T's. I love adding new techniques, technology, and treatment modalities. And that just keeps me, loving going into work. And, we've recently added same day milling. So I love doing crowns more because I love same day milling. We have a 3D printer. We love making night guards and surgical guides and models, sleep and airway. There's a whole new treatment modality that we added. So adding little things, and it could be something small, like a new composite technique that I learned. But if you're just stuck on that hamster wheel of dentistry, doing the same old thing over and over and over again, then you're going to burn out. And for me, I've staved off burnout because I keep adding new things to my practice every month, every quarter, every year.
And so you're staying curious. I love the fact that you're bringing in the new technology, CEREC machines, 3D printers, and How did you digest the idea of having to I mean, there's serious investments. Like you're kind of really committing to learning a new technology. What would you tell a dentist that isn't embracing some of these new tools in order to take the plunge and start incorporating them in their practice?
Yeah, well, I think there's many reasons. One, I was just getting tired of, for me, with the same day milling machine, I was getting tired of making temporary crowns or training staff to make temporary crowns, and then staff, this was, after COVID, staff would come and go, and I'd have to train someone new, and I just got tired of that. And the time that it took with the lab to send back the crown, the return on investment with a milling machine for me was there, but it's the return on fun. I just love the technology. Patients love it. The staff loves not having to do a temporary crown, and you can market it. It's something you can market and get new patients from. Now, something, for example, like my 3D printer, that was a pretty expensive piece of equipment, but we were able to get rid of, any we got rid of all the goop, all the stone, all, we're no longer, we're fully digital. So for me, I wanted to to become a fully digital office. Is it cheaper to pour up models in stone? Probably. But I love my 3D printer. Patients love it. I love marketing it. I take social media posts with it. It's fun. So sometimes there's a clear ROI and sometimes there isn't. But again, if it makes you enjoy going into work every day, then I say it's worth it.
Yeah. So that being said, what are your goals for the next 5 years? How are you preparing yourself today for, changing technology and the landscape of dentistry? Where are you headed?
So great question. And I think often dentists don't have goals, or they don't think about goals or write them down or document them. And I think it's extremely important to do that. Uh, Personally, I'm 50. My kids are 10 and 12. So I think about them in college, and I'm going to probably be practicing for the next, probably 13 to 15 years. I'll be in private practice. And then from there, I've built a whole second career where I can continue on and coach other dentists. I'm also uh, a co-founder of a startup called Use Flomo, and Flomo is a software that helps dentists with standard operating procedures and just trying to get them to become more efficient, productive, and less stressed. But I'll be practicing, in private practice for the next 10 to 15 years. But I'll continue to add new things, and I'll always be up on the latest technology, and I'm always going to try to improve. If there's something that I feel like in my office or with my staff that we are slow with, we keep running into barriers, or my staff keeps having the same questions, or they're getting stuck. I'm always going to try to improve on that, and it makes my life better, the staff's life better, and ultimately the patients pick up on this. But Flomo for me is going to be my future, because once I started documenting all my systems and protocols, it absolute game changer. Because when if you ever had a legacy staff member leave and they left with all that knowledge in their head, and now you have to train new staff, it's extremely exhausting and very expensive to train new staff. So my goal is with Flomo is to help dentists do it once, document it, and then bank it and put it in Flomo, and it's there if you need it tomorrow or 6 months from now. And it could be anything from how you want your crown set up to be, to how you want your staff to answer the phones, to how to fix equipment, to everything from you turn the lights on to shutting the compressor down, and everything in between. So I'm super excited about that too.
So are you doing demos? Is there a way that listeners can learn more about Flomo?
Yeah, go to Use Flomo, and Flomo is Flomo, and useflomo.com. Me and my co-founder Jeff Greenberg is a local dentist in Massachusetts. We came up with that name because Flomo is a combination of words of FOMO, fear of missing out, and workflow. So that's where we came up with Flomo. And yeah, we're gonna go on the website, and you can get on a waiting list. And once we launch, then we'll let people know when it's available.
And where can people find your book?
Yeah, so you can look me up. I have a website called thestressfreedentist.com, and you can find all my books on there, and they'll link you to my Amazon page. Or you can look me up on Facebook or LinkedIn, or just search me up on Amazon.
Okay. Well, hey, Dr. Block, thanks so much for coming on. And yeah, I know we've had great conversations, and I do encourage, other doctors that are maybe seeing some symptoms of burnout to get in touch with you so that, you can give them some tips and tricks and how to, stay on the right track and maybe redefine what success looks like in their daily practice.
Yeah, and I also just wanted to mention I did co-found the International Academy of Dental Life Coaches, which, for me, I always knew that I was going to go through therapy, being a psychology major, but I know a lot of dental professionals don't know where to turn if they're realizing they're having a problem. And we created the International Academy of Dental Life Coaches, or www.iadlc.com, for people to reach out to us, and we'll match you up with a life coach that'll help you. But we also help dental professionals that are looking for a career change and want to coach other dentists. So if you're out there and you want to coach, if you're looking for a career change, or you're slowing down or retiring from dentistry, but you still want to be a part of it, then we have a great community full of coaches where we get together and help each other.
Awesome. Yeah. Well, thanks so much for all the work you're doing in the industry. And yeah, it was a really great conversation.